just a quick review of the book, The Vital Shoulder Complex, an illustrated guide to assessment, treatment, and rehabilitation. Basically, the book's divided up into a whopping 18 chapters, so it contains a lot of information. I don't know that I'll name off all 18. I guess it's kind of old, but let me give you an idea. Like say, chapter 1's anatomy, always a good place to start with the shoulder. 2 is muscles. 3 goes into posture. Chapter 4 goes into like walking and its relationship to the shoulder. They also have like differential diagnosis of shoulder pathology, relationship of the cervical spine, your neck to the shoulder, differential diagnosis of pain at the superior angle of the scapula. So that's pretty specific chapter there. Relationship of the pelvis, the SI joint to the shoulder. So they're covering all the things that might influence a shoulder problem. Chapter 9, muscle energy techniques. That's where you contract a muscle to try and move a bone to help the pain. Goes into muscle testing, treatment of shoulder, cervical spine with muscle energy techniques. They have pathology of shoulder and the cervical spine, assessment of the shoulder. Special tests. All kinds of myofascial soft tissue treatments. That's treating the soft tissues around the shoulder, not the joint. Have some taping techniques. And then they have chapter 18 is rehab and exercise protocols for the shoulder. So yeah, as you can see, there's just a whole lot that's covered here. I would like to point out, I don't really think this is really for the layman. Like say my shoulder hurts. Let me go and let me find a book to help me with that. I don't think this is a book for just your average person, because there's a lot of information in here that you might not understand in anatomy and stuff. But I think this is rather for like a physical therapist or any healthcare practitioner that treats a lot of shoulder problems. I think this is appropriate for. If you do have what I would suggest doing is find a specific book on a specific problem that is for the layman. For instance, if you have like a rotator cuff problem, this is a book actually good for clinicians too, because it's got a lot of good evidence-based material in here. 6-Minute Torn Rotator Cuff Solution. I think it's written by a physical therapist. Briefly, the differences between the books. Part 1, like what exactly is it rotator cuff? Has a lot of pictures and stuff, goes over that stuff. What is the rotator cuff? That way anyone, average person walking around on the street doesn't really know that, rotator cuff has 4 different muscles. What does it do? Here's a good part. Answers you need to know. Basically goes into question and answer section. What are the symptoms of a rotator cuff tear? Are there any arm maneuvers that indicate you have a tear? All evidence-based answers, I might add. And it quotes lots of studies to back it up. Where exactly does it tear at? Are there different kinds of rotator cuff tears? I have rotator cuff tear. I'm in a lot of pain and I need surgery, right? Not necessarily. If you take like 100 people with torn rotator cuffs, some have big tears, some have small tears. They don't really find a lot of correlation between the tear size and how bad a pain level you have. So you can't really say, oh, I'm in a lot of pain, I need surgery. Some people have a small tear and a lot of pain. Some people are walking around with big tears. Actually, they're asymptomatic. That's what the research says. So no, just the pain level doesn't really correlate to the surgery, if you need surgery or not. What happens if I just leave my rotator cuff tear alone? Here's a good example of how this book is really evidence-based. The only way you're going to know the answer to that is if you look at all the studies where they take people with a rotator cuff tear and they don't really treat it, and they follow them for like 5 or 10 years. So what happens over the long run? Does it get better? Does it get worse? Does it stay the same? How does exercise compare to surgery? So here again, the only way you're going to know, evidence-based book, you have to look at the randomized controlled trials. So this book is looked at they've compiled all the randomized controlled trials of exercise versus surgery. So you take 100 people, 50 are randomized to exercise, 50 are randomized to surgery. You follow them for, 6 weeks, 6 months, 6 years, and you find out, who did better over the long run. Short answer, according to multiple randomized controlled trials, and this is a consistent finding in the research, whether you've had surgery or whether you do a good exercise program, you're going to end up at the same place. So that's evidence-based medicine. To that end, the book ends with a program, exercise program. It's 3 different levels, beginning, intermediate, advanced. So there's something there for everybody. So yeah, this is a good book, good example of a book for evidence-based book for a specific problem for the layperson. This would be more like for a clinician that wants to learn a whole lot more, about treatment for it, other things they can do, differential diagnosis. So yeah, very good book. So if that's what you're looking for, definitely check it out.